Have you ever noticed how a simple thing like eating an apple doesn't feel so simple anymore? Maybe it's that strange twinge in your gums, or the way your dentures don't quite sit right like they used to. Or perhaps you've just started avoiding crunchy foods altogether. If that sounds familiar, you're not alone. As we age, our mouths age too. Quietly, gradually, and often without much warning. But here's the good news. Taking care of your teeth and gums in your 50s, 60s, and beyond doesn't have to be complicated. In fact, it's one of the most powerful steps you can take to protect your overall health. See, your mouth isn't just about smiling for photos or enjoying your favorite foods, it's directly connected to the rest of your body. Inflammation in your gums can sneak into your bloodstream. Poor oral health has even been linked to heart disease, diabetes, and cognitive decline. So yes, your toothbrush might be a bigger health tool than you thought. In this video, we're diving into the often overlooked world of senior dental care. We're going to talk about simple, realistic tips that can make a big difference, from everyday habits to the kinds of things your dentist might forget to mention. And it all starts with one simple truth. Your mouth deserves just as much attention as the rest of you. Let's start with something most people shrug off: dry mouth. You might think it's just an annoying side effect of getting older or taking medications. But dry mouth does more than make you thirsty. Without enough saliva, your teeth lose their natural protection. Saliva helps wash away food particles and keeps bacteria from running wild. Without it, cavities and gum infections become much more likely. So what can you do? Sip water regularly throughout the day, not just when you feel parched. If you're taking medications that cause dryness, like those for high blood pressure or depression, ask your doctor if there's an alternative. And skip the sugary mints or cough drops. They might offer temporary relief, but they also feed the very bacteria that cause tooth decay. Instead, look for sugar-free lozenges with xylitol, which can actually help fight cavities. Another silent culprit is gum disease. It's sneaky. It often doesn't hurt, and early signs like bleeding when you brush are easy to ignore. But don't. Gums that bleed are gums that are inflamed. And over time, that inflammation can destroy the bone that holds your teeth in place. The best defense? Gentle but consistent brushing twice a day with a soft, bristled toothbrush. And yes, flossing still matters, especially now. If you've never been a fan, try soft picks or water flossers. They're easier on the hands and much more comfortable for sensitive gums. Now that we've looked at two often ignored signs, dry mouth and bleeding gums, it's time to turn our attention to a few more simple but powerful shifts you can make to protect that smile for years to come. One of the easiest things you can start doing right now is being more mindful of what's on your plate. Yes, what you eat still matters when it comes to your teeth. Crunchy vegetables like carrots and celery don't just support your overall health. They actually help clean your teeth while you chew. Think of them as nature's toothbrushes. They stimulate saliva, scrape away food particles, and are full of vitamins that support strong gums and bones. But it's not just about adding the good stuff, it's also about watching out for sneaky troublemakers. Acidic foods and drinks, like citrus fruits, tomatoes, and soda, can slowly wear down the enamel on your teeth, especially if your mouth is already dry. That doesn't mean you have to give up your favorite orange or morning cup of tea. Just rinse your mouth with water afterward and avoid brushing right away. Give your enamel a little time to recover. And speaking of brushing, let's talk about your toothbrush. If it's been 6 months or more, or the bristles look frayed, it's time for a new one. Think of it like changing the oil in your car. Small maintenance that makes a big difference. Many people over 50 actually brush too hard, thinking it'll clean better. But aggressive brushing can wear away enamel and damage your gums. A gentle, circular motion is all it takes. If holding a toothbrush feels uncomfortable, there are larger handled options or electric brushes with a soft grip that make the job much easier and more effective. Now, let's not forget your tongue. It's easy to overlook, but your tongue can harbor bacteria that lead to bad breath and even gum disease. Give it a gentle scrub when you brush, either with your toothbrush or a tongue scraper. It takes just a few seconds, but the freshness it brings is worth it. Another helpful habit: schedule regular dental visits, even if you wear dentures or don't have many teeth left. A lot of folks think, well, I'm not having any pain, so why bother? But problems like oral cancer, infections, or bone loss often show up without symptoms, Catching these early can save you a lot of discomfort and money down the road. Even just a simple cleaning can make your whole mouth feel brand new. One last thing for this section, and it's something many of us never think about: hydration. Yes, water again. Not just for dry mouth, but for flushing out bacteria throughout the day. Think of it as rinsing your mouth from the inside out. Carry a small water bottle with you and take little sips during the day. It's a tiny habit, but over time, it can make a huge difference. There's no need to aim for perfection. Just a few steady changes, done consistently, can protect your smile and your health. And now that we've covered some of the practical daily habits, let's turn to a few deeper strategies that can help you keep your teeth and your confidence strong for years to come. Let's talk about something we don't often say out loud: how your smile affects your confidence. It's not just about vanity. When you don't feel good about your teeth, you're less likely to laugh freely, speak up in social settings, or even eat in front of others. That kind of self-consciousness can quietly chip away at your joy. And it doesn't have to be that way. If you've been living with missing teeth or poorly fitting dentures, don't just grin and bear it. There are more options now than ever before, from flexible dentures that mold more comfortably to mini implants that offer better stability. Even if you're not ready to invest in those changes today, knowing they're available and asking your dentist about them can open doors you didn't know were there. One thing that surprises a lot of older adults is just how connected oral health is to the rest of your body. Research has shown links between gum disease and heart disease, stroke, diabetes, and even Alzheimer's. Think of your gums as the gatekeepers. When they're inflamed or infected, bacteria can travel into your bloodstream and trigger problems far beyond your mouth. It might sound a little scary, but it's also empowering, because it means that by caring for your teeth and gums, you're also caring for your brain, your heart, and your future. And here's a gentle reminder: don't wait until something hurts. Pain is often the last sign of a problem, not the first. If you notice changes like swelling, a sore that doesn't heal, or even a change in how your dentures fit, speak up. You know your body best. Trust those instincts. Now, let's wrap things up with a little encouragement. You've made it this far in life. You've overcome challenges, raised families, built careers, cared for others. Taking care of your smile is one more way to care for yourself. You deserve to eat without pain, laugh without hesitation, and smile with full confidence. Remember, it's not about being perfect. It's about being consistent. Brush gently, floss however you can, sip your water, keep those checkups, and pay attention to the small signs your mouth gives you. These little choices stack up day by day to create real, lasting health. If this video helped you or made you think differently about your dental health, I'd love to hear your thoughts. Have you faced challenges with dry mouth, dentures, or gum issues? What little tip has helped you the most? Share it in the comments. Your story might help someone else out there. And if you haven't already, don't forget to give this video a thumbs up, subscribe to the channel, and share it with someone you care about. We've got so much more to talk about when it comes to living your healthiest, happiest life after 50.